Well, hi, everyone. Welcome. I'm Jen Peed. I'm Senior Director here at AARP, and I'm joined by some colleagues from the American Association of Critical Care Nurses, Dr. Sarah Delgado, Strategic Advocacy and Policy Advisor, and Ramon Lavandero, Senior Strategic Advisor. I'm also joined by my colleague, Nicole Harriman, our Senior Advisor here at AARP. Nicole manages this program, and it really is your first point of contact for any questions or needs you may have during and following the application process. So I just wanted to thank you all for taking time to join us to learn about the Nursing Innovations Fund for 2025. Our focus this year is the nursing workforce and healthy work environment. This request for proposals seeks innovative and replicable solutions that strengthen the nursing workforce by creating and sustaining healthy work environments and improving recruitment and retention rates of registered nurses. This opportunity is made possible by AARP and AACN Critical Care. We'll get into the details of the RFP in just a few minutes, but first I wanted to just go over housekeeping. This webinar is being recorded and it will be available on the Campaign for Action website. Feel free to use the chat feature to share ideas, make comments, or ask questions throughout the call, and we will have a designated Q&A time where we will be able to answer questions posted in the chat, or you can also, raise your hand and ask live. We will call on you to ask your questions, and our frequently asked questions document will be updated with questions discussed today and questions received and answered after today's webinar up until the application date. That document also can be found on the Campaign for Action website. And just, to ensure best audio, please keep your line on mute and your video off unless you are speaking. So our agenda for today, I will provide this brief overview of AARP. We're administering the awards, and we'll hear from Sarah, who will discuss AACN Critical Care and the application of their healthy work environment standards and assessment tool, which is a requirement for this RFP. Then I'll briefly touch on some eligibility criteria, award details, the application process, and then Ramon will facilitate our question and answer period. So about AARP. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 and older to choose how they live as they age. With a nationwide presence, AARP strengthens communities and advocates for what matters most to more than 100 million Americans, 50 plus, and their families: health and financial security and personal fulfillment. We recognize that nurses are vital to the care of older adults and their families, and nurses are the largest and most trusted provider of health services, practicing in a variety of care settings, such as health systems, homes, nursing homes, schools, workplaces, and more. We know nurses are uniquely positioned to help individuals and communities overcome barriers to health and well-being. And we also know that the National Council of State Boards of Nursing report shows that in just a few years, by 2027, about 1/5 of the 4.5 million registered nurses intend to leave the workforce. So in an effort to mitigate this projected shortage, we teamed up with the American Association of Critical Care Nurses to offer innovation grants for projects that create and sustain healthy work environments that support the well-being and effectiveness of nurses, ultimately enhancing patient care. Now, let me turn to Dr. Sarah Delgado with the American Association of Critical Care Nurses.
Thank you, Jennifer. So AACN is the world's largest specialty nursing organization. We have 135,000 members and counting, still increasing. We have our national conference coming up, and we usually see a boost in membership around this time. Our vision is to create a healthcare system driven by the needs of patients and families, where nurses can make their optimal contribution. As Jennifer described, we know that fundamental to that vision is establishing and sustaining healthy work environments for nurses. So just a point of clarification, we talk about work environments and sometimes our brains go to the physical environment that nurses work in. But what we're talking about with our healthy work environment standards is the context in which care is delivered, which is largely driven by the relationships between healthcare team members. Next slide. In 2005, we published the standards for establishing and sustaining healthy work environments. There are 6 different standards you see in the slide here. We revalidated and published the 2nd edition of the standards in 2016. The standards are the same, but they are now supported by additional data. So we view these standards as evidence-based practice because there is data showing that when these standards are implemented, nurses are more likely to report a higher quality of care, less likely to report intent to leave, less likely to report moral distress, and more likely to report a higher percentage of shifts with appropriate staffing. So these are evidence-based standards to support care delivery and nurse retention. We have on the left hand of this slide is a screenshot from our latest national survey of nurses, which is how we collect data about trends in the health of the work environment from our acute and critical care nurses. You'll see the print is a little bit small, but I'll tell you there was a little bit of a dip in 2013 in scores of the health of the work environment. We think that was related to the introduction of EHRs and other changes that were happening in healthcare. There was a much bigger dip in 2021. That survey was conducted during the Omicron wave, and we think that affected those scores. So in addition to demonstrating the correlation between healthy work environments and multiple outcomes for nurses and patients, what this survey gives us at AACN is a way to frame our work. So you'll see on the slide that staffing was one of the lower rated of the 6 standards. So we put extra effort into that standard, and we have a bunch of initiatives we've done to address staffing. That being said, these 6 standards are not discrete. The reason the diagram shows the circles overlapping is because they are all interconnected. So going to the next slide. In your projects, you may focus on one of the 6 standards, but you will also find that you are leveraging the other 5 to make that standard happen in your work environment. So in your projects, you will be using, as Jennifer said, our healthy work environment assessment tool. This assessment is conducted at the start of the project and at the end of the project so that we can compare scores before and after. This tool is used to evaluate the health of a work environment in which teams are all caring for the same population of patients. So it is appropriate to use the HWEET. We call it the HWEET for short, but it's the Healthy Work Environment Assessment Tool. It's appropriate to use this tool in an outpatient clinic where everyone is working with the same population of patients, and an inpatient unit where everyone's working with the same population of patients, procedure unit, anywhere where there's a team that is caring for the same group. The tool would be less useful in a classroom setting that's inclusive of nurses who all work in different places. So if your project involves gathering nurses from different clinical settings, you might want to consider having each of them conduct the assessment tool in their clinical environment, because that's going to be where it's meaningful. Because what the tool does is it gathers everyone's perspective on the health of the work environment, and it gives you a mean score. So you understand where you are in implementing that standard in that specific environment. So on the slide is a sample summary report. You can see we give mean scores. There are 24 items on the tool. They're all Likert items, so it only takes about 15 minutes to complete it. It's anonymous and confidential. The one caveat I will say is that at least 5 people have to answer the assessment tool in order for us to create this summary report. Because to protect confidentiality, we cannot produce a report if there's too few responses. And we provide an email address that's on the slide where you can reach out if you have questions or issues in using the Healthy Work Environment Assessment Tool. We also have a video and an FAQ document and a place where you can download all the items if you're curious. So we are here to support you in using this tool as part of your project. And I think I hand it back to you, Jennifer.
Okay, thank you, Sarah. So this is in the now we're going to go to the nuts and bolts, which you're probably hoping we'll get into. This is the eligibility criteria for the proposals. Proposals must offer innovative and replicable solutions that strengthen the workforce by creating and sustaining healthy work environments and improving recruitment and retention rates of registered nurses. Proposals should really describe and provide evidence of the problem that you're trying to, fix or change, then clearly describe the solution that will be implemented. We'd like you to describe how the project will implement one or more of the critical care standards for establishing and sustaining healthy work environments that Sarah just walked you through. And proposals need to describe how these following required metrics, we have a handful of required metrics. You're welcome to add additional metrics if you'd like, but these 3 really need to be included. The number of registered nurses impacted by the project over the grant period. We need to see retention rates of registered nurses as indicated by registered nurse vacancy and turnover rates in the care setting at the beginning and then again at the end of the project, and the change in the HWEAT team scores. So that's the survey scores that Sarah just went through at the beginning of the project and again at the end. In addition to what we just discussed, proposals will need to confirm that the project team will complete the survey, the HWEAT team's pre-assessment by August 1st, and complete the HWEAT team's post-assessment and review the results by August 1st, 2026. So it'd be pre-assessment August 1, 2025. That's a month after the project starts, and then again a year later. Proposals need to clearly explain the role of each stakeholder identified for this project, demonstrate support of dedicated time for this project by the chief nursing officer or another comparable executive leader of your organization. And we've put together a sample letter in the resources section of the RFP to make it easy for you. You can certainly use that letter or adapt it, but just make sure an official signs and submits that with the proposal. Instead of or in addition to the letter, the application can list the executive leaders as project partners and describe their role and commitment of resources. We also want to make sure that proposals describe how the anticipated success of this project could be replicated and sustained over time, and describe how the project results will be disseminated. And in your dissemination plan or section, also discuss key audiences you would share this with. And then, of course, with all applications, complying with the details, the formatting requirements that are all spelled out in the RFP. And just a high level of the award details, these are one-year projects. Awards of up to $20,000 each will be given to the selected projects. All projects will start July 1st. And we often get a lot of questions about what can we use the funds for? So you can use funds for staff, personnel, meetings, supplies, project-related travel, if you have contractors or consultants, but you may not use funds to subsidize healthcare costs, to support clinical trials, to construct or renovate facilities. They may not be used for lobbying or political activities, or as a substitute for current funds used already in place for activities. We're really looking for something new and fresh and different that you want to try to strengthen the work environment of your care setting. Let's see, preference. So we do prefer, preference will be given to applications that include frontline staff as key partners, that demonstrate support with that signed letter we just talked about from your CNO or similar executive leader. If you're able to demonstrate matching funds or in-kind support, that's great. It's not a requirement, but it is preferred. And we prefer public entities or tax-exempt nonprofit organizations. We're not excluding groups, but this is who the preference goes to. And we do think it's important for you to know that if you are awarded a grant, there are some expectations. We want to make sure that you are aware there's going to be some paperwork that needs to be processed, and that needs to be done pretty quickly to ensure all grants start July 1st. Grantees will participate in a quarterly learning collaborative with the other grantees, with our team at AARP and our colleagues at AACN Critical Care. It's really designed to foster learning and to share resources with each other and to just help the grantees overcome any hurdles they might be having along the way and ensure your projects are as successful as possible. You will be expected to complete a fairly brief final narrative report that really focuses on your project outcomes and learnings so that we can possibly share that with others and disseminate that. And then we would like you to collaborate with us, AARP and AACN Critical Care, after the project ends to share those learnings. It might be through blogs or a webinar, just really depends on what the learnings look like. Next slide. And how to apply. So applications should be submitted as a PDF to our email, nursinginnovations with an S at aarp.org. No later, you're welcome to apply sooner, but the cutoff is 10 p.m. Eastern Time, Friday, April 4th, 2025. Again, earlier submissions are welcome, but in fairness to all the applicants, we cannot accept late submissions. The RFP application and frequently asked questions document can be found on the Campaign for Action website. And as previously mentioned, we will update the questions as new questions arise. Our funding decisions are made by a review team comprised of subject matter experts from AARP and AACN Critical Care leadership, staff, and advisors. So we're really thrilled to launch this RFP. We can't wait to see what amazing work comes out of the field. And now we're ready to open it up to some questions and turning it back to Ramon for his facilitation.
So I'm sure you were planning for a way longer presentation. Joke's on you. It's time really for questions. Any and every type of question are welcome. As you see on the slide, a couple things to note. One is you feel free to use the chat stream, and you can access the chat stream from the bottom navigation bar, or raise your hand. To access the hand raise, there's a heart probably at the bottom of your navigation bar. It says react. Click on that, and then you'll have raise hand as a choice. And with that, let's go. Okay.
So Ramon, there's a couple in the chat.
Yep. Let's do those.
Do you need us to read them to you, or how come?
No,
what's your preference?
Just keep an eye on them, and I'll go through and start reading them out.
Great.
So Tony Beam would like to know, can you talk about matching funds? Are they expected to contribute it now or after the first iteration is complete to continue? Jen, do you want to?
Sure. Well, we can both chime in. I will just say matching funds, again, are not required. One reason we wanted to specify that is last year we had a similar RFP and they were required. So this has been a change in how we're drafting the RFP this year. However, anytime there's external support or other levels of support, diversified funding, it sometimes does strengthen the sustainability of efforts. And that's why it's a preference, but not required.
Okay. Next, Zoom user unidentified. Would you mind explaining the partner match preference more deeply? Back to you on that.
Yeah, I think we just covered it.
Okay. We have a hand raised. Danny Witkowski would just unmute yourself and please ask your question.
Hi there. We have one area that has 3 separate areas. So as part of our OB area, it feeds up to 1 manager, but we have mom, baby, we have labor and delivery, and we have ICN. Would you recommend delivering or submitting the the H step to each separate area and not one as a whole?
I can take that question, Ramon, if it's helpful.
Please jump in.
It depends a little bit on the size of the unit, but yes, Danny, I think if each of those areas cares for a different group of patients, you will get better information if you conduct the H-suite across the 3 different areas. What that means is identifying a point person in each of those clinical areas to be the point of contact for the H-suite in that unit. And then that person can be responsible for downloading the reports and providing them back to you as the project lead. Did that help answer your question?
Yes, thank you very much.
Okay, next from the chat stream. There's a double question here, getting at the same point. 1, are appendices allowed with the application, and do they count toward the page limit? And 2, do references count toward the page limit? Nicole, do you want to take that, or at least take a first stab since you do the technical review?
Yeah, absolutely. So there is a 10-page limit. The only items that are accepted outside of that 10-page limit are letters of support. So assuming when you say references, I'm going to think that that's synonymous with kind of letters of support. So those do not count toward the page limit. Any additional appendices do.
Okay, another one from the chat. Can we apply for a program that we're already providing with an outside vendor? Amber Browning, rather, you asked that. Would you mind unmuting yourself and explain a little bit more what you mean by that? Okay. We'll take a stab at
Yeah.
it.
Yes,
And
go ahead. Do you want to, Ramon?
yeah, go ahead, Jen, and I'll add if need be.
We're probably going to say the same thing. This being an innovation fund, we're really looking at doing something different. So we wouldn't want to fund something that completely just replaces funding for something you're already funding with no change. However, if your innovation is maybe you have a program in one unit and now you want to offer it in a different unit, or you want to innovate on that a little bit and do something differently to try something new out to see if it helps build a healthier work environment, then that might be something we could consider. Ramon, anything to add to that?
What I think the one thing I would add is, which you talked about in terms of what funding can be used for, and that is if outside vendor means you are purchasing a program or service from an outside vendor, you cannot be using grant funds to offset your bill.
Yes.
If you're expanding on it, as Jen said, if you're looking at other innovative ways to try out something different with that type of program, something in that direction, as long as it's meeting the other grant requirements, then that's something that you could consider. Okay, let's go to raised hands. Jennifer Hewlett, could you unmute, please?
Sure, thank you. I would like to ask clarification about the clinical trial aspect. It said on the slide that no clinical trials of unapproved devices, but when it was mentioned, it sounded like no clinical trials. And I'd just like to clarify what was meant by that.
Sarah, did you want to take a first pass at that?
I think this was part of the original RFP when the Innovation Fund was launched. Jennifer, is that right?
Mhm.
And so because we're looking for nursing innovations, it kind of dovetails with the prior question. A clinical trial would be a larger project in place, I imagine.
Mhm.
Do you want to share, Jennifer, what you're thinking of for the project, or
Well, sure. Briefly, we're considering some clinical outcomes. So it's not really a clinical trial. It probably would classify more as feasibility, but
Okay.
we're certainly connecting it to some clinical outcomes. So I just wanted to make sure that we're understanding the intent of the
Mhm.
call.
That's
I-
right.
yeah.
And Jennifer Hewlett, if you'd like, based on what you're hearing in the webinar today, if you wanted to email to nursinginnovations@aarp.org more detail on your question and what you're looking for, we're always happy to any of you to provide further support and clarity, partly to move you in the right direction, but also to let you know that maybe what you're aiming for is not going to fall into place, and so you don't misuse your time in trying to get an application together.
Certainly. Thank you. I'll do that.
Sure. Okay. Okay, back to the chat stream. Do you accept proposals from nursing education programs? If so, how would we fulfill the H-Suite score requirements? That's from Jack Pedersen. Could you unmute for a second if your mic is working? Because we'd like to know what you mean by nursing education programs.
Hi, yeah. So we I work for National Louis University, and we just recently launched a nursing education program. So it's a pathway directly to receiving certification and receiving your bachelor's in nursing. And we were wondering if it would be possible for us if we had a project. Essentially, our program is we're in Chicago, and we're trying to get started with providing support for an aging population in Illinois, and also bringing nurses from parts of the city that otherwise would not have the opportunity to become nurses and involve them in the nursing profession. So I'm just wondering, that seems like it's very much in line with what you're looking to fund, but I just wanted to confirm.
Got it. So you're an academic program, basically, and the short answer is yes and no. You need to have a clinical partner. And we, for example, have currently funded a couple programs. One that I'm thinking of is aimed at engaging more Hispanic students into nursing. However, it's run by actually an academic medical center, and it's in partnership with nurses there. And part of that is because the H-Suite assessment requirements and the stats on recruitment, retention of nurses, and that have to come from a clinical site. So yeah, I would certainly pursue, but knowing that you would have to have that partner, and chances are you probably have some type of clinical partners already if you're moving students into clinical sites. So does that cover what you were asking?
Perfect. Thank you so much.
Okay, you bet. Okay, next back to raised hands. Jill Storer, could you unmute?
Hi, everyone.
Jill.
Question, our facility is pursuing Beacon, and now that they're on an annual basis, we have to complete the H-Suite in the fall, usually for the remainder of the year. Can we use the same H-Suite scores for the grant application as we can submit for Beacon as well?
I can take that question, Ramon.
Please, yes.
It's helpful. So yes, you can.
Okay.
We would need to work with you, and again, it may be something we take offline and email about, because we want to make sure the timing works for both
Yeah.
programs. But we did work with a program that had a similar situation last year, so we can support that. You would use the H-Week once for both programs. The repeat is where you may run into a little bit of a conflict, because you need the scores, the repeat scores for your final
Partic-
report at the end, which really means doing it in the summer for the grant program, if that
Okay.
makes sense. But we can work
Mhm.
with you on the timing with the Beacon program for sure.
Okay, thank you.
Raised hand also, Sarah Knippa. If you could unmute. Sarah, we lost you. Okay, let's go to the chat stream and come back. Okay. Are there restrictions for institutions that are past awardees? Meaning there really aren't. If past awardees, it could be that you have a totally different project, certainly fair game. But it also could be that you're a past awardee who now is looking to extend the original project based on the findings of an original project, whether, as Jen said earlier, to other care settings, for examples, or to engage other partners. So no, there aren't any real restrictions on past awardees applying. Jen, anything you would like to add to that?
No, you covered it well. Thank you, Ramon.
Okay. We covered appendices, but there was a question about page limit that was added on, and that was, how about citation references in AMA or APA, background evidence? Any citations are part of the 10-page limit. So you think carefully. When you are citing something, it's not really just citing it for the sake of, if you will, making a stronger case, but rather think carefully about which citations would add strength to the case that you're trying to make. Okay. Chat stream. Pam Stout asks, while focused on nursing, if the innovation includes increasing communication between providers and nursing, and education is provided to both through the project, is that allowed, or is it specific only to nursing staff? That would, Sarah, do you want to jump in on that? Because it certainly falls right into the whole concept of healthy work environments.
Yeah, that is allowed, and I would even say encouraged. The nurses don't work in a vacuum. We absolutely work as part of an interprofessional team, and that is why the tool, the Healthy Work Environment Assessment tool, is designed for measuring the health of the work environment based on the perspectives of every team member. So the physicians in your project would answer the same survey that the nurses are answering, and you could look at the health of the work environment through everybody's lens. It sounds like a great project, Pam, to look at communication between those groups, because that is an area that we have an opportunity to really improve. So
Heartily second that. So thanks, Sarah. And I guess this is the Sarah moment. Sarah Knippa, who had her hand raised, went to the chat stream. And Sarah's question is, do you recommend a project specifically focused on one of the HWE standards, or can it be a clinical project that incorporates the HWE standards? Go, Sarah Delgado.
I'm happy to answer that. It can be either one. So if you have a innovative idea for improving quality of care in some way, you can build in how you will leverage the HWE standards to accomplish those goals. That's absolutely a project that we would evaluate. As long as you're measuring the outcomes that Jennifer described along the way, retention, as well as the number of nurses impacted and the HWEET scores. You can design a project that way, or you can make your project very specific to one of the standards. We have found that projects that are specific to one standard, the scores change in other standards too, because you do leverage the other standards in implementing the project. So that's a great question. I would encourage you to consider both forms of projects.
Thanks. From the chat stream as well, a question that was asked and answered, but I will call it out. Jennifer Hewlett asked, could you please talk about the 12% indirects? Is this included in the 20K or is it added to the 20K? And Jen Peed replied, it's included in the $20,000 total. Okay. Cole McCoy in the chat stream asked, do projects targeting workflow improvement for nurses qualify for this grant? I would say yes, but again, think of the connection to healthy work environment and what aspect of it. If it's workflow improvement, because ultimately the improvement in workflow is also making for a better work environment. That would be one of the things to consider. And as Sarah Delgado just said, one doesn't have to be addressing all of the work environment, the healthy work environment standards. There might be a focus on one in particular. And then we would still, with the assessment tool, be measuring all of the standards. Anything to add to that, Sarah?
No, I think that's right. Again, I encourage you, if you want to reach out with a question, Ramon, Jennifer, Nicole, and I can help offline. If there's a specific question about the workflow project idea, we can help.
Thanks. A question that was asked in the chat stream and answered. Anita Scarbeck asked, how many projects do you plan on funding? And Nicole answered that for us. We're looking to award 15 grants of up to $20,000 each. And we're looking at a variety of geographic settings and care settings. So we're really trying to have a spread and not have, for example, certain clusters of states totally flown over and others heavily funded. Okay. Nicole, any questions that I've missed?
Did we touch on, so I know we addressed Pam Stout's question, and there was a follow-up question in chat. Would nursing and physicians do the same survey, or would we need to have a separate cohort survey for each?
Sarah Delgado, can you talk about HWEET team?
Sure, that they would do the same survey. So as long as the nurses and physicians in the group you're working with are caring for the same population of patients, a single point person would set up the survey on the AACN website and share the link with everyone in that team. So physicians, nurses, you could include respiratory therapy. You might have other professional social workers. There's a lot of folks who work together to care for a population of patients. So you can include everyone in the team and they all answer the survey at the same link. And then you get the summary report at the end. I hope that helps.
And that's actually a good opportunity to call out that when the healthy work environment standards were framed, and that was 20 years ago now, that was in 2005, because AACN issued them, and AACN is a nursing organization, they were framed in the context of nursing. But when you look at them carefully, and especially as they've been revised once since then, they're talking about the work environment, not about nurses' healthy work environment. So it will affect everybody, not only care providers, but obviously patients and families. So that's a distinction that's very well worth making, because while we're looking for certain metrics that are regarding nurse retention, nurse recruitment, and so forth, those can't exist in isolation. We don't work as those of us who are nurses, we don't work in isolation. So one thing to keep in mind as you're trying to match this up, in other words, don't overthink it. Go with what seems reasonable, what seems natural with your gut. And again, please reach out to us with any questions. We prefer having the questions than having an application that was close but missed a big point, and we didn't have a chance to provide any guidance. Any other questions? Raised hand or in the chat stream? Okay, as you've seen now on the slide on the screen, the recording from this webinar will be posted, and we strongly encourage you also to just replay it again, scrub through it as you need to if you want to get back, especially some of these questions. If you want to look at some of these questions more carefully, just go back to the recording. And again, please write to us, and we'll support you from there. If there's nothing else, thank you. There were at the peak of this, I think 70 people on this webinar, which is fantastic. And if that means 70 applications, we're happy campers. So thanks very much. And to all of you, hope you have a good rest of the week.